Hello and welcome to Vital Pulp Treatments, an introductory video on endodontics. Today we'll be going over the 6 vital pulp therapies as listed in the Guide to Clinical Endodontics put forth by the AAE. These include apexogenesis, pulpotomies, pulpectomies, indirect, and direct pulp caps. First, we'll start with apexogenesis. I've drawn here a tooth with a mature closed apex. Here, I'll show you a tooth with an immature apex where the root end has not yet closed. Over time, immature teeth progress to a state of apical maturity and root closure. In some teeth, we need to promote this apexogenesis by exposing vital and asymptomatic pulp, controlling the bleeding that ensues, removing part of the pulp, and directly medicating the vital pulp left behind, usually with calcium hydroxide or MTA. This can be done in permanent teeth that have not yet reached apical maturity, but have deep caries that has extended into the pulp. These teeth must be free from periapical pathology, which would indicate that the inflammation has already reached the apex. Because we are only removing a coronal portion of the pulp, we need the rest of the pulp to be healthy so that the tooth apex can continue to develop normally. On this slide, I'll demonstrate the procedure for apexogenesis. Here we have our vital but apically immature tooth with deep caries. In this procedure, the coronal portion of the pulp will be removed. Then, medication, which I'll show in blue, will be applied directly to the vital pulp. Ideally, this will promote healing and allow the tooth to progress to a state of apical maturity. On this last tooth, I'm showing that the portion of the pulp that was not removed has remained vital and has allowed the root end to mature and close. Next, we'll take a look at pulpotomies. They're also known as pulp amputations. Here, I'll draw a vital tooth that is endodontically compromised. Similarly to apexogenesis, the provider will remove part of the pulp. However, in a pulpotomy, the space left behind will be filled with a biologically compatible material that will maintain the vitality of the remaining pulp. Pulpotomies are done in primary and in permanent teeth. In primary teeth, they are performed when vital pulp is exposed or if the tooth has irreversible pulpitis. In permanent teeth, they can be done as an emergency treatment while the patient awaits conventional root canal treatment or as an interim procedure on an apically immature tooth. We should also note that different materials are used as the biologically compatible material shown in blue in permanent and in deciduous teeth. The next procedure we'll take a look at is called Pulpal Debridement. It is also known as a pulpectomy or as a pulp extirpation. This procedure involves removing all the vital pulp within a tooth. For example, if this tooth is causing pain in an emergency visit, it can be used to relieve this pain until a conventional root canal treatment can be performed. Now we'll take a look at 2 forms of pulp capping. First, we have the indirect pulp cap. Here we have a young permanent tooth which is vital and has deep caries that extends past the dentin and into the pulp. I'll draw the dentin surrounding the pulpal tissue here, and then I'll indicate the extent of the decay in black. Now I'm going to zoom into the part of the tooth where the deep caries lies. Here, the carious excavation will stop short of the pulp chamber. We will leave a thin partition of carious dentin and apply the material, which is usually calcium hydroxide or MTA, onto this thin dentin divider. In this procedure, no pulpal tissue is actually removed. This procedure can be done on permanent teeth with immature apices which have deep caries and no periradicular pathology. In the first visit, the dentist will excavate the caries, medicate, and then restore the tooth. And in the second visit, which is about 6 to 8 months later, the restorative material and remaining caries mass will be removed before restoring the tooth. So I'll note right here what happens at the first visit as opposed to the second visit. The next form of pulp capping we'll take a look at is the direct pulp cap. Again, I'll draw a vital tooth with a carious lesion that extends into the enamel, the dentin, and the pulp. Once more, we'll zoom in to take a closer look at the procedure. Here, a minimal amount of pulp tissue is removed and the vital pulp is directly medicated, usually with calcium hydroxide or MTA. Direct pulp caps often involve pinpoint exposures of vital pulp and always involve the direct placement of material onto vital pulp. It's necessary for the tooth in question to be isolated via rubber dam and for any bleeding to be controlled so that the capping material may be placed before restoring the tooth. Here's the summary slide of the vital pulp therapy options we went over in today's video. Thank you so much for watching. I hope it was helpful and I'll see you next time.